What do you know about asthma? And if someone were to have an asthma attack right in front of you, would you know what to do? I mean, this could be your friend, your colleague at work, or perhaps your child, or even a neighbor. Or maybe you're just traveling and something just happened around the airport right where you are. Would you know what to do? Back to 2009, I arrived at Aberdeen, an international student, desperate for help because I spent more of my time in A&E than even in my classroom. That was how bad my asthma was. And in that desperate need for support, I just realized that this is Scotland. I mean, with all due respect to people of other nationalities, but I do believe in the expertise of our medical professionals. I believe in the services provided by the NHS. But that still did not fix my asthma. Neither the 368,000 people living with asthma in Scotland, because we have inhalers free. We can go into the hospital at any time, but our asthma was not being controlled. So what we found in those very early days was that with asthma, it's not just about the medication, because if it were, here in Scotland, we would not be having so many asthma deaths, even in this generation. So it's medication and education working hand in hand. And that was where the Asthma and Allergy Foundation started. Providing that advice, that support, that information, that education that is so lacking even till date. Because really, we are the only asthma charity in Scotland doing this work in the community, supporting thousands of children, adults, their families and carers, and even friends, so that they can work together as a community to ensure that we never lose another life to asthma. Because the death of one person to asthma is one too many. A condition that 90% of deaths from it can be preventable. It shouldn't happen, not in this age and time.
I came on board AAF quite early on as a member and chair of the Board of Trustees. I was really quite intrigued and very passionate about the goal and the aspirations of the organization, which is to reduce asthma deaths and improve asthma care in Scotland. And of course, we all know nobody says no to Martina. Our passion and its persistence gave me very much sleepless nights. Obviously, the Board of Trustees has grown quite significantly, and now there's myself, Mr. Pinto, Sarah, and Dr. Fumi as part of the Board of Trustees. We also have a very amazing advisory board, and we also have our ambassadors and also partners who partner with us in all that we do. I guess one of my main things is also to see that Asthma and Allergy Foundation has reduced demonstrably the amount of asthma admissions into hospitals in the northeast of Scotland. If you are passionate, if you are interested in the amazing work we are doing, you can come in as anything, as a volunteer, as a partner, funding partner, as an ambassador. Why don't you reach out to us today?
I was diagnosed with exercise-induced asthma when I was about 16, 17. And around that time, my swimming career was just starting to take off. So to be diagnosed with asthma was initially a bit of a blow. I wasn't sure how this was going to impact my career. However, what I found was having a sport actually allowed me to help control, understand my diaphragm and work with my breathing so that it didn't hold me back. And from then I was able to compete at 3 Olympic Games, 4 Commonwealth Games. So I really value and respect asthma. It's obviously a condition that can be quite life-threatening. However, I had a lot of support. I was taught on how to use the inhaler, and I was able to manage it around my training and allowed me to compete at the highest level that I can compete at. The AAF, I think, is a fantastic organisation that allows education and support for a lot of young individuals who do get diagnosed with asthma. There's a lot of information out there that needs to be told. A lot of myths as well that need to be dispelled, that when you are diagnosed with asthma, that's it, you can't do anything, you can't do exercise. I'm hopefully an example that you can still compete in exercise as much as you want. It's knowing and understanding your body, how to work with it, not against it, and understanding that breathing is very important, but making sure that you listen to your body and having the support to make sure that you don't put yourself into any danger or risks.
I think education is really important. I think what's particularly important is that it's patient-centred education. Doctors sometimes talk a lot of rubbish that doesn't make a lot of sense to many people. So I think education is important, but what again, I get less young every day, and I realise that over time we recognise as a profession that doctors and nurses are very much focused on the patient. So the education is very much about what the patient wants, what the patient understands. So for example, does the patient understand that this blue inhaler they've been given is to be taken only when they have asthma symptoms? And do they understand that the brown inhaler is to be taken all of the time? Very simple message that we all presume everybody knows, but a large number of patients don't fully understand that. Another aspect of education that's very important is how to take the inhaler. It's all well and good having the inhaler, but if you don't take it properly, it's not going to do its job. So again, it goes back to the basics. So the basics of education are understanding which treatment to take, how to take it, when to take it, but also to understand how the asthma affects the patient.
I'm Vicky, and I've been with AAF for about 3 years now as Head of Service and Health Promotion. So I support Martina, I support the wider team, Claire in Edinburgh, Pam in Aberdeen, Stephen in Aberdeen as well. I also work alongside adults who have lost family due to asthma. I work with young people and children who've got asthma, their families and their carers, to support them, educate them so that no one has to go through loss again. It's just vital that we promote education, because that is how we're going to reduce asthma deaths in the future.
The great thing about Asthma and Allergy Foundation is that everyone who works here or volunteers with us, we all have a personal experience with asthma. We either have asthma or we've lived with people who have asthma, so we have a very good understanding about how challenging it could be to have uncontrolled asthma, but we also know how you could live very, very healthy with asthma. So we're passionate about it, and this drives the work that we do to ensure that everyone who turns to us for support gets the support that they need.
My communication skills they greatly improved, so getting out and actually giving health promotional presentations in the community to people in sheltered housing, actually being able to do that greatly improved my ability to communicate and impart information to people in a detailed way, but in a clear and concise manner.
I think the more that people hear about the work that's been done and the opportunity for them to help in various ways and support the charity, whether it's in promotion or fundraising or marketing, as well as the medical side. I think there are opportunities for people to come on and get on board and help. And again, if they get involved with the charity, they'll see that it's a great bunch of people with good trustees, staff and other volunteers. So it'd be a good group to get involved with. So I would encourage anybody to get involved with it.
As with all charities, there's always a way for you to give back. There is nothing too small or insignificant about your contribution. It can just be an hour a day that you have to answer the phones, or maybe it's the education that you have, the contacts you have. Nothing about you is wasted. And people like the Asthma and Allergy Foundation need people like us to look a little bit further to see where we can help, because there isn't enough funding to go around for everybody. And we all can play a part in making the world better and making people healthier and getting what's needed so that we're not falling through the cracks.
So just being able to support the charity to raise awareness of the issue that it is, it's been really good and it's been a great experience, and I'd really recommend it for anyone.
I am delighted to support and introduce the Breathing Room project, through which children and young people living with the condition of asthma, their parents and carers will all benefit from the vast range of services available, including, among others, access to evidence-based health information, asthma management workshops, and of course, confidential advice and support. I am confident that the Breathing Room project will have a significant, lasting and positive impact on improving the lives of children, young people and adults living with the condition of asthma in the Greater Glasgow and Clyde region.
Hi, my name's Claire and I'm the Health Promotion Officer for AAF in Edinburgh. I'm also a collaborator with many other organisations that support our work, such as Home Energy Scotland, who we collaborated with to improve the home conditions for those living with asthma and allergies. We also most recently collaborated with ASH, which is a stop smoking charity, to deliver stop smoking workshops in schools and within the community to support those living with lung conditions to quit smoking and prevent young people starting vaping and smoking.
I started as a volunteer responsible for community engagement activities, and over the period of time I had very good mentorship. I saw AAF as a family and I grew and enhanced most of my skills and took on new skills and went on to become the project coordinator, which I enjoy because as part of my roles, I ensure that other team members have what they need to thrive and succeed, so that together we push the missions of the foundation. And what I enjoy most about this role is that I go out there to connect with people, support service users, and also support the health promotion team to deliver the work and ensure that no one dies needlessly from asthma.
My job sees me going around schools in Aberdeen City and Aberdeenshire, delivering workshops to our primary schools, our secondary schools. The workshops teach our young people about asthma and allergies. We look at the symptoms, the triggers, the medication and how to administer it. We talk about what to do in an emergency situation. We talk about the importance of taking your medication properly, managing your medication, remembering to take your inhaler with you. Letting the children know that if they manage their medication, they can have a healthy, active and full life. You will see myself and my colleagues in a number of different locations across Aberdeen. We often have a stand in community centres, shopping centres, sports centres to raise awareness about asthma and allergies. We have our online learning That's another fantastic opportunity to learn about asthma and allergies. We provide support to people living with asthma and allergies, providing confidential advice and support, helping families and their carers, as well as those suffering from asthma.
I was shocked to find, as a proud Scot, that Scotland had the worst deaths to asthma in the Western world. The UK wasn't far behind that. But the foundation had the answer, and that was education. And recently we had a grant from the National Lottery. We used that to educate the people in the Aberdeen area. And during that time, we reduced hospital intakes by 68%. So I wanted to take this to as many people as possible. So we've used that same training to develop an e-learning platform, which is available to you all on our website. So I'd encourage you to go along and see how your business or your university or your school can take up this training and save lives to asthma and help us reduce this.
In the course of this 15 years, together, we have generated over 4 million in cash and in-kind donations to this charity to further the brilliant work we have done together. We have raised over £1 million in cash, and in-kind donations have exceeded over £3 million. This is from free premises worth over £120,000 per annum, donated to us by Ritz Farm Properties Limited for 7 whole years, where we did brilliant work, and together we supported over 63,000 people in that premises, from workshops for children to parents, training for first aiders, and the work we did has been transformational. I would also want to extend my sincere appreciation to 3 individuals that have worked with us so remarkably over the years, but sadly they are no longer with us, especially Dr. Ian Small, a respiratory consultant that started with us from the very beginning and supporting the work that we have done, and also the Donald John from STV, who made sure that every materials, every workshop, every event we had was filmed by STV to raise awareness of the brilliant services we're delivering in the region, and also to promote and raise the profile of the charity. I would also want to thank Alison Chandler. She's not here, but I'm sure her children and her husband would see this. Alison was the one that taught me how to do fundraising, because I came from an oil and gas background with no experience whatsoever, and she was there with me. And there was something she always said. She said, Martina, the only thank you I want to hear is that in another 20, 30 years, you can tell me that millions of lives have been saved through the work that you're delivering in the charity. And it's just unfortunate that she's not here to say 15 years, but we truly appreciate all the support that she and her team at AGVO gave us. And I'm sure Mike Melvin will be here tonight, and I just wanted to say thank you to all of you. We just wanted to say a massive thank you to all of you that have been a part of this journey the past 15 years. Our funders, our sponsors, our partners. I would want to especially thank the National Lottery Community Fund, because they have sponsored and funded elaborate work that we've done over this 15 years. And we have in our midst today David Lamont, who is the funding officer from the National Lottery Community Fund. While I cannot go through thanking every individual, I just cannot go without saying, thank you to our trustees, our ambassadors, our independent clinical advisors, Professor Turner and Dr. Mella, both at the Children's Hospital and the ARI Asthma Clinic. They are the ones that ensure that every information and materials we put out there is evidence-based and complies with the asthma guideline. So we are really thankful for all their support. We also want to thank all our staff, our volunteers, and everyone that has really come through this journey with us the past 15 years. And we look forward to working together to see what we can achieve in another 15 years to come. Thank you. Thank you. Thank you.